Did you know that worms affecting our beloved dogs can also impact our health? Although they might seem harmless, these parasites can have serious consequences when they transmit diseases to humans. In this video, we will explore how worms like Toxocera and Ancylostoma can cross the barrier between dogs and people, revealing what you need to know to protect your family and your pet. Get ready to uncover surprising details and learn how to prevent these infections. Let's dive into the world of worms and their health consequences. When it comes to worms that can be transmitted from dogs to humans, three main types deserve special attention due to their potential impact on health. Let's learn a bit more about them. First, we have Toxocera canis, the parasite responsible for toxocariasis. This worm is common in dogs and spreads through their feces. Toxocera larvae can remain in the soil for long periods, increasing the risk for those who come into contact with contaminated areas. When humans, especially children, accidentally ingest contaminated soil or do not wash their hands properly after playing in affected areas, the larvae can migrate to various organs such as the liver, lungs, and eyes, causing a range of problems from respiratory symptoms and fever to severe ocular complications. Another important parasite is Ancylostoma caninum, commonly known as the hookworm. This parasite lives in dogs' intestines, and its larvae can contaminate the soil. Infection in humans occurs mainly through direct contact with contaminated soil or sand, or when larvae penetrate the skin. The main manifestation of this infection is cutaneous larva migrans, a painful and uncomfortable condition where larvae move under the skin, causing intense itching and lesions. In more severe cases, the worm can cause more systemic symptoms such as abdominal pain and anemia. Finally, we have Echinococcus granulosus, which causes hydatidosis. This parasite is less common but extremely dangerous. Dogs are definitive hosts for Echinococcus, and humans can become infected by ingesting parasite eggs present in dog feces or through contact with contaminated food. Echinococcus larvae form cysts usually in the liver or lungs, which can grow and cause severe symptoms such as abdominal pain, persistent cough, and even fatal complications if not treated appropriately. Each of these worms has a specific life cycle and mode of transmission, but they all share a common risk: the possibility of affecting human health. Understanding these parasites and implementing preventive measures is crucial to protect both our health and that of our beloved pets. Transmission through contaminated feces. The most common mode of transmission is through contact with feces from infected dogs. Many worms, such as Toxocera canis and Ancylostoma caninum, release their eggs or larvae in dog feces. These feces can contaminate the soil and, consequently, recreational areas, gardens, and parks where children play or adults engage in outdoor activities. When hands come into contact with contaminated soil and subsequently with the mouth, the eggs or larvae can be ingested, leading to infections. Direct contact with contaminated soil. In addition to feces, the soil where dogs have defecated can become contaminated with worm eggs. Infection occurs when people walk barefoot or handle soil without proper protection, especially in areas where dogs are allowed. Ancylostoma larvae can directly penetrate the skin, causing skin infections. It is essential to wear shoes and gloves when handling potentially contaminated soil to reduce the risk. Contact with contaminated food. Worms can also be transmitted through food contaminated with eggs or larvae. This can happen when raw or poorly washed food comes into contact with dog feces or contaminated soil. Ensuring that fruits and vegetables are thoroughly washed and avoiding the consumption of uncleaned food can help prevent this mode of transmission. Insufficient personal hygiene. Lack of personal hygiene is a critical factor in the transmission of worms. If hands are not washed properly after touching soil, animals, or objects that may be contaminated, there is a higher risk of ingesting eggs or larvae. Teaching and practicing good hygiene, such as washing hands with soap and water, is an effective preventive measure. Contact with infected animals. Although less common, close contact with infected dogs can also lead to transmission. This can occur when handling or petting an animal that has worm eggs in its fur or in the surrounding environment. While not a primary transmission route, it is important to maintain the hygiene of pets and their areas to minimize the risk. Symptoms of worm infections transmitted from dogs to humans can vary widely depending on the type of parasite involved and the severity of the infection. Knowing the signs and symptoms is essential for seeking appropriate treatment and preventing complications. Let's explore the main symptoms associated with the most common worms. Toxocariasis, caused by the Toxocara canis worm, can provoke a range of symptoms depending on the location of the larvae in the body. When larvae migrate to the lungs, they can cause respiratory symptoms such as persistent cough, shortness of breath, and wheezing, which can often be confused with common respiratory conditions like asthma or bronchitis. Severe infections can also lead to abdominal symptoms, including abdominal pain, nausea, and vomiting, along with a general sense of malaise and fatigue. In more serious cases, larvae can migrate to the eyes, resulting in eye pain, blurred vision, and even vision loss, a condition known as ocular toxocariasis, which requires immediate medical attention. Infection with Ancylostoma caninum generally causes a condition known as cutaneous larva migrans. The main symptoms include intense and persistent itching in the affected area, where the skin has come into contact with contaminated soil. The larvae move under the skin, creating visible tracks that may look like lines or serpentine paths, and these lesions can be painful and cause inflammation. In more severe cases, the migration of larvae to other parts of the body can result in abdominal pain and anemia. Hydatidosis, caused by Echinococcus granulosus, is a rarer but potentially serious infection. The growth of cysts in the liver or lungs can cause abdominal pain, discomfort, and abdominal distension. If cysts form in the lungs, they can cause persistent cough, chest pain, and difficulty breathing. A ruptured cyst can lead to a severe allergic reaction and a generalized infection known as anaphylaxis, which is a medical emergency. In addition to these specific symptoms, worm infections can cause general symptoms such as fever, fatigue, unexplained weight loss, and weakness, and some infections may be asymptomatic, especially in the early stages. To prevent worm infections, it is essential to ensure that your dog receives regular deworming. Consulting with a veterinarian for an appropriate deworming schedule helps control and eliminate intestinal parasites that may be transmitted to humans, significantly reducing the risk of transmission. Maintaining personal hygiene is crucial. Wash hands with soap and water after touching soil, playing with pets, or handling animal feces to remove any possible contamination of worm eggs or larvae. Encouraging children to wash their hands frequently, especially before meals and after playing outdoors, is also important. Care for the environment by keeping it clean and free of dog feces. Collect and dispose of feces properly and regularly, and prevent dogs from defecating in areas where children play or where food is prepared. Clean and disinfect areas where dogs frequently spend time. When handling soil or working in the garden, use gloves and closed-toe shoes to avoid direct contact with contaminated soil and prevent children from playing barefoot in outdoor areas where dogs frequent. Wash fruits and vegetables thoroughly before consuming them, especially if they were grown in potentially contaminated areas, and avoid uncleaned or undercooked food. Educating your family about the risks of parasitic infections and the importance of hygiene is crucial. Teaching children not to touch animal feces and to wash their hands frequently can prevent many infections. Regular veterinary checkups to ensure your pet is free of parasites and discussing care and prevention with the veterinarian are important steps to maintain your pet's health and reduce the risk of infection for the whole family. Treatment for worm infections in humans varies depending on the type of parasite and the severity of the infection. Correct identification of the worm is crucial for effective treatment. For toxocariasis caused by Toxocara canis, treatment typically involves the use of antiparasitic medications such as albendazole or mebendazole. These medications help eliminate the larvae from the body. If there are severe ocular or neurological symptoms, treatment may include corticosteroids to reduce inflammation and protect affected organs. It is essential to follow up with a specialist to ensure complete recovery and avoid potential complications. For cutaneous larva migrans caused by Ancylostoma caninum, treatment includes the use of topical or oral antiparasitic medications such as albendazole or ivermectin. These medications are effective in eliminating the larvae responsible for the infection. To treat skin lesions, anti-inflammatory creams may be used to relieve itching and irritation. The treatment approach should be comprehensive, aiming not only to eliminate the infection but also to alleviate symptoms and prevent new infections. Hydatidosis caused by Echinococcus granulosus requires more complex treatment due to the presence of cysts. Initial treatment typically involves albendazole, which helps reduce cyst size and control the infection. Often, surgery is needed to remove the cysts, especially if they cause significant symptoms or complications. Surgery should be performed by a specialist in parasitic diseases or at a reference center to ensure complete removal of the cysts and minimize the risk of recurrence. General treatment measures. Regardless of the infection type, treatment should be accompanied by general care, such as maintaining good hydration, a balanced diet, and, in some cases, treatment for associated symptoms like fever and abdominal pain. It is crucial to follow medical guidelines and complete the full course of treatment to ensure the complete elimination of worms and prevent recurrence. Post-treatment prevention. After treatment, prevention remains essential. Maintain good hygiene practices, follow up with regular medical checkups to monitor health and ensure that the infection has been fully treated, and continue with preventive measures to avoid reinfection or transmission to others. In conclusion, understanding how worms can affect both dogs and humans is vital for protecting your family's health. By taking preventive measures and maintaining good hygiene practices, you can significantly reduce the risk of worm infections and ensure a healthier environment for everyone. If you suspect an infection, seek medical attention promptly for accurate diagnosis and effective treatment.